Before I came to see Dr. Wyll, I had been suffering for about 2 years of just dull headaches, not feeling good, stuffy. On paper, I am healthy, but I just was tired of not feeling good.
I noticed on exam that Kathy did have a deviated septum. I obtained a CAT scan of her sinuses, which didn't show a considerable amount of sinus disease or inflammation, but it did show that the natural openings to her sinuses were very narrowed. And so I felt that she would benefit, one, from a septoplasty by straightening her septum. In addition, I thought she would be an excellent candidate for the balloon sinuplasty procedure.
We actually did a CT scan to check my sinuses. There was nothing on that she found. She thought maybe I was allergic to some things, so she said, "Kathy, let's do a blood test. Let's do that first before we go in and become invasive on you." We did that. She called me and said, "Kathy, you're negative. You're not showing allergic to anything. What I suggest for you, there's this procedure out called Balloon Sinuplasty."
The balloon sinuplasty device is a device that has been around for about 5 years. It's a very minimally invasive way of entering into the sinuses. We take a small, thin, lighted wire and we guide that into the sinus. At that point, we advance the balloon over the wire into the narrow passageway of the sinus, and then we dilate open the balloon, and that opens up the sinus opening. And at that point, we remove the balloon, and the sinus opening actually remains patent in over 92% of the patients.
I sell real estate, so I made sure I didn't have any appointments that week, but as far as talking on the phone and getting up and feeling okay, I was fine.
The balloon sinuplasty device can be done either in office or in the hospital setting. The majority of patients benefit from it in the hospital setting because in addition to opening up their sinuses, like Kathy, she also needed a septoplasty, straightening out her septum. And so doing them in combination while she's asleep under general anesthesia was the best for her.
My life has been totally changed since I've had this surgery. I have never felt better in my life. I have more energy. I feel like I got the Kathy back that I knew. And I just feel great.